Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today I was going to talk about when do you use intravenous antibiotics and when do you use oral antibiotics. And it's not clearly defined, but in general, severe NeuroLyme and neurobartonellosis, and when I say severe, I mean, you know, brain on fire severe, is probably going to require IV antibiotics. And IV antibiotics can be administered via a port, which is inserted here on your chest, or by a PICC line, peripheral insertion catheter. And you access the PICC line or the port, once or twice a day. And you flush it with heparin, you flush it with saline. Um, I think it's SASH, saline, antibiotics, saline, heparin. And that's the best way. It's been a long time since I've done IV. I used to do it a lot, but um, I stopped because of legal reasons, and it's SASH. So, when do you use IV antibiotics? Well, you do it when someone needs it, and that's a clinical decision, and that decision is different for every doctor. For me, if the oral antibiotics are not working and the patient is completely bedbound and and is a poor detoxifier, um, I would suggest that one of the best things to do is to get him with a doctor that can do IV, and that they can administer glutathione or vitamin C or Myers cocktail, in addition to the or uh, saline, um, or lactate ringer solution, as well as antibiotics and heparin. This is things that you have to be well trained to do this. This is not just fly by night. Oh yeah, we're just gonna do a little bit IV. No, 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 no. You need to be properly trained and know how to handle a Lyme patient when they need IV. And the reason that and I'm a perfect example, so I'll use myself. Um, 23 years ago, when I had tick-borne illness, I lost the vision in my right eye. I couldn't see anything. And the neuro-ophthalmologist was really concerned about the pressure in my eye and felt that I needed IV antibiotics along with really high-dose prednisone. So I got a PICC line inserted in my arm, and I administered my own antibiotics. Had a nurse come once a week, check the dressings, and everything was fine. And then all of a sudden, I had a very strange pain, very strange. I never felt this pain before, and it was about right here. And I would go in and I tell the doctor, I said, something is not right here. I know something is not right. And everybody was like, oh, that's just part of the herx. I'm like, no, I don't think this is part of the herx. And I kind of had to get forceful and say, look, I'm telling you there's a problem. You need to figure this out. And so they said, okay, go to the emergency room. I went to the emergency room, and sure enough, I had a clot in my line that was like this big. And so they had to pull the line, and then I went on some blood thinners for a while to declot. Bartonella can be, well, they all can actually, all the tick-borne illnesses can cause um, abnormalities in clotting, especially if you have a genetic propensity. So, those are things to consider when you're going to do the IV route. Um, you know, Using IV is on an individual basis. It's also very expensive. You oftentimes will have to get it and pay for it, out of pocket, because insurance companies don't like to pay for it. They'll pay for it when a neurologist orders it, or when I think a rheumatologist are the two that they will pay. Otherwise, it's really difficult to get IV antibiotics paid for by by insurance, and so that's a deterrent. But there are clearly some people that do not respond to oral antibiotics and they need IV. And in addition to IV antibiotics, they usually need IVIG. IVIG stands for intravenous immunoglobulins, and that's to boost the immune system as well. And IVIG is generally administered to people who have autoimmune encephalopathy. So it's a combination of antibiotics alongside IVIG. And who's ever doing that, they need to be experienced. There are some outpatient facilities that will do the IVIG. That has to be ordered by a neurologist, I'm pretty sure. So you can't just get this from anybody. And there's no rules for ordering IV antibiotics, but it is the last resort. And you really want to try and, as best you can, treat with orals just because it's much easier on the body. And the Herxheimers usually are not as bad. Usually. Not always, but usually. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.